Have you ever felt winded just from bringing in the groceries? Needing an extra pillow to get comfortable at night? Or maybe you've looked down at your swollen ankles and said to yourself, "It's just been a long day on my feet." We have a simple phrase for all of this, don't we? We call it getting older. But I want to talk to you today, one-on-one, because I've seen this too many times over the past 30 years. What if I told you that many of these things we chalk up to normal aging aren't actually normal? What if they're quiet, persistent whispers from your heart trying to send you a message? Not a dramatic warning, not a senior health tips 365, just a quiet, ongoing request for help. Now I know what you're thinking. Why is a brain doctor talking about the heart? Because I worry deeply about heart failure. And here's why. Your heart is the engine that powers everything, especially the brain. When the heart weakens, when it stops pumping efficiently, every part of your body suffers. But no part suffers more quickly or more dangerously than your brain. The shocking truth is this: more than 6 million Americans are living with heart failure. And for many of them, the diagnosis came far too late. They lived with signs for months, even years. They ignored them because they seemed normal. They thought it was just age catching up. Today, we're going to change that. We're going to learn how to listen before the whispers turn into screams. I'm going to walk with you through 13 early symptoms of heart failure. And I need you to stay with me until the very end, because these symptoms often hide behind everyday aches, tiredness, and discomforts. They are subtle. They seem small. But once you learn to recognize them, you'll feel more prepared, more in control, and more empowered to take care of your body or a loved one's. Let me ask you, have you ever dismissed a symptom because you thought it was just getting older? If you have, just type yes in the comments. Let's be honest with each other today, because that honesty is the very first step to staying strong. And if you find this helpful at all, please stay with me to the very last second. By the end, you will not only understand your body's language, you'll have a real, clear path to becoming your own best advocate.
This is often the very first sign, and it's the one we brush off the quickest. This isn't the breathlessness you feel after a workout. It's not huffing and puffing from jogging or climbing a hill. It's the kind of breathlessness that's new, that happens during things that used to feel easy. Walking to the mailbox, carrying laundry up the stairs, pushing a grocery cart down the aisle. That's called exertional dyspnea. Here's what's happening. Your heart is a pump. In heart failure, that pump becomes weakened. It struggles to push oxygen-rich blood out to your muscles. So when you exert yourself, even just a little, your muscles ask for more oxygen, and your heart can't deliver it fast enough. Your lungs try to make up the difference. They make you breathe harder, faster. But the problem isn't with your lungs. It's a pump problem. So how do you know it's not just being out of shape? Pay attention to the change. If last year you could walk through the grocery store just fine, and now you have to stop and rest halfway through, that is not normal aging. That is a red flag.
Have you gradually gone from 1 pillow to 2? Maybe now you're using 3. Or do you find yourself sleeping upright in a recliner just to feel comfortable? This might feel like a small change, but it's something we call orthopnea, and it's a critical sign. Here's why. When you're upright during the day, gravity pulls fluid down into your legs. But when you lie flat at night, that fluid moves back into your chest. A healthy heart can handle that shift. But if your heart is weak, it can't pump that extra fluid effectively. So the blood starts to back up, especially in the blood vessels around your lungs. Pressure builds. Tiny amounts of fluid leak into your lungs. And suddenly, lying flat feels tight. You feel like you're suffocating. It may be subtle, but it's very real. So you prop yourself up with pillows. That way, gravity keeps the fluid lower in your lungs, and the upper part stays clear enough for you to breathe. Here's how to know it's not just a comfort preference. If lying flat causes a sense of breathlessness or chest tightness, and that feeling goes away when you sit up, that's orthopnea, and it's a medical symptom.
This one is frightening. You're asleep, and suddenly, you jolt awake, gasping for air. Your heart is racing. You're in a panic. It feels like you're drowning. You rush to the window, sit upright, trying to breathe. That is called paroxysmal nocturnal dyspnea, or PND. It's a more severe version of the fluid shift we just talked about in orthopnea. Here's what's happening. After a few hours of lying flat, enough fluid has collected in your lungs, and suddenly, your brain detects a lack of oxygen. It flips into panic mode. It wakes you up. You feel like you can't breathe. Your chest is tight. You might even feel like you're choking. This is not a bad dream. It's not night terrors. And it's not sleep apnea. With sleep apnea, breathing pauses gradually. But with PND, you wake up suddenly with a powerful need for air. Sitting or standing for a few minutes usually helps, but the fear of these episodes can even make people afraid to fall asleep again. Please don't ignore that. This isn't ordinary tiredness. This isn't the kind of fatigue you fix with a nap or a good night's sleep. This is something deeper, more constant, more stubborn. You feel exhausted before the day even begins. Simple tasks, folding laundry, preparing a meal, taking a short walk, feel like you're carrying a backpack uphill. That's not normal aging. That's your body rationing energy. Here's what's happening inside. When the heart weakens, it can't pump blood efficiently to every part of the body. So your body starts prioritizing. It sends blood to the most critical areas, your heart, your brain, your kidneys, and it reduces flow to your arms, legs, and muscles. That means your muscles don't get the oxygen and nutrients they need. The result? You feel a constant low-grade exhaustion, not just physically, but mentally too. Your stamina fades. You skip activities you used to love. You tell yourself, I'm just getting older. But if that tiredness doesn't go away with rest, if your energy steadily declines, please listen to that signal.
Let's talk about something you can actually see: swelling. Maybe your socks leave deep lines around your ankles. Maybe your shoes feel tight at the end of the day. Maybe you've looked at your feet and said, they look puffier than usual. That's not just from standing. That's something we call peripheral edema. It's one of the clearest signs your heart may be struggling. Here's what's happening. Your circulatory system is like a two-way road. Arteries carry blood away from the heart. Veins bring blood back to the heart. But when the heart weakens, it can't pull the blood back efficiently. So blood begins to pool, especially in the lower parts of the body, the legs, feet, and ankles. At the same time, your kidneys sense that less blood is reaching them, so they panic. They start retaining salt and water, trying to fix the situation. But the extra fluid has nowhere to go, so it starts leaking from your blood vessels into your surrounding tissues. That's where the swelling comes from. Now, how do you know this is not just ordinary swelling? If it's caused by heat or long hours sitting, it usually improves overnight. But in heart failure, the swelling is more persistent. It's often pitting edema, meaning when you press your finger into it, the dent stays for several seconds, and it usually affects both legs equally. That's a strong, visible sign that something's not right. This kind of information truly matters, because when we catch heart failure early, we change the entire story. If what you're hearing today feels helpful, would you take a quiet moment to like this video?
And if you haven't already, please subscribe to Senior Health Tips 365. That simple action helps this life-saving knowledge reach more people. People who may be quietly living with symptoms and not even know it yet. You never know who you might help just by sharing what you've learned today. If you step on the scale and notice you've gained 2 to 3 pounds in just one day, or 5 pounds in 1 week, that's not fat. That's not muscle. That is fluid. And it's a big deal. Here's what's happening. As your heart weakens, your kidneys react by holding on to salt and water. That extra water has weight. A single liter of fluid weighs 2.2 pounds. So a 3-pound gain overnight? That's your body holding on to over a liter of fluid. And it's not just sitting in your belly. It's in your legs, your tissues, and eventually your lungs. That's why cardiologists often recommend this simple habit. Weigh yourself every morning. Same time, same scale, same clothes. Because the scale will often catch heart failure symptoms before you feel them. And that early warning could keep you out of the hospital.
If you find yourself getting up 3, 4, even 5 times a night to urinate, and that's something new, please don't just assume it's a bladder issue. This might be a subtle sign of heart failure. Let me explain. During the day, extra fluid pools in your legs due to gravity. Your weakened heart struggles to pull it back up into circulation. But when you lie down at night, that fluid returns to the bloodstream. Your kidneys suddenly get flooded with fluid, and they kick into high gear, producing urine to try and get rid of it. That's why you're waking up. Now, how do you know this is a heart issue? Pay attention to the volume of urine. You're not just waking up for a trickle. It's full bladder after full bladder. Your body is trying to offload what the heart can't manage. It's not just inconvenience, it's a signal. Have you noticed a persistent dry cough, especially one that gets worse at night? Or maybe you feel a wheeze when you lie flat. That might not be allergies, and it's probably not a cold. It could be what we call a cardiac cough. Here's what's going on. When the heart is weak, blood backs up into the lungs. That causes tiny amounts of fluid to leak into the airways. Your body senses that fluid as something it needs to remove, so you cough. But it's not productive, no mucus, just dry and persistent. Sometimes that fluid in your airways causes a wheezing sound, like a chesty whistle, and you'll notice it gets worse lying down, and better when you sit up. That's because sitting uses gravity to keep the fluid lower in your lungs. If your cough fits that pattern, don't ignore it. Your heart may be the cause. Do you ever feel like your heart is fluttering, like it's racing for no reason, skipping a beat here and there? That can be very unsettling, and it can also be a warning sign. Here's why. In heart failure, the heart muscle can stretch out or weaken. This affects its electrical system. The result? Irregular rhythms, called arrhythmias. Sometimes these rhythms develop because of heart failure. Other times they cause it by forcing the heart to work too fast for too long. You might feel a flutter, a pounding, a skipped beat, or just a strange awareness of your heartbeat. If these episodes happen frequently, especially if they're paired with dizziness, fatigue, or shortness of breath, your heart is under strain and it's trying to tell you.
Have you felt dizzy lately, or lightheaded when you stand up? Maybe even close to passing out? That could be a sign your brain isn't getting enough blood. In heart failure, the heart's output drops. It's not pumping enough blood to maintain normal pressure. When you stand up, your body needs to adjust quickly and push blood upward. But a weak heart can't do that well, so your blood pressure drops, and your brain, the most oxygen-sensitive organ, feels it first. You feel faint, off balance, confused, and in severe cases, you may even collapse. Please don't brush this off as just dehydration or a slow day. This is your heart talking. I know,
Many of these symptoms can feel confusing. They come and go. They overlap with so many other things. And sometimes they leave you wondering if it's just in your head. Have you ever felt that? Have you ever brought up a symptom to your doctor just because something didn't feel quite right? If you have, I want you to know that takes courage. And it could be the step that changes everything. If you feel comfortable, share your experience in the comments, because your story might be the encouragement someone else needs to finally make that call. Now, this one might surprise you. You wouldn't normally connect digestive problems with your heart, but they are deeply linked. In heart failure, your circulation slows, and that includes blood flow to your stomach and intestines. So what happens? Digestion slows down. You start to feel bloated, even when you've only eaten a little. You may feel full after just a few bites. Your appetite drops. You might think, I must be getting sensitive to certain foods. But the real issue could be congestion in your abdomen. Because fluid doesn't just collect in your legs, it can build up around your stomach, even in your liver. This is called ascites. It puts pressure on your belly, your organs, your entire digestive system. So you lose your appetite, not because you're full, but because your body can't handle more food. If meals are becoming a chore, if you're eating less not by choice, but by discomfort, this could be your heart, not your stomach. This one is very specific, but very telling. Do you feel short of breath within seconds of bending over? Like when you tie your shoes or pick something up from the floor. We call this Bendopnea. Here's what's happening. When you bend at the waist, pressure increases in your chest and abdomen. If your heart is already struggling, that little extra squeeze pushes it over the edge. The pressure inside your heart builds rapidly, and fluid can back up into your lungs almost immediately. You bend down, and suddenly you're gasping. This isn't just being out of shape, it's a specific response to fluid overload, and it's often a sign of advanced heart failure. It's subtle, but very reliable. Please don't overlook it.
Now, let's talk about your hands and feet. Have they been cold, even when the room is warm? Do you sometimes feel like your extremities are colder than usual? This can be a real warning sign. Your body is smart. When your heart can't pump strongly, it starts to prioritize. It sends blood to the most vital organs, your heart, brain, and kidneys, and it reduces blood flow to your hands and feet. That's why they feel cold. Now, here's something your doctor might notice too. It's called a narrow pulse pressure. This is the difference between your systolic, top blood pressure number, and your diastolic, bottom blood pressure number. Normally, that difference is about 40 points. But when your heart pumps weakly, your top number drops. So the difference, or pulse pressure, gets smaller. Let me give you an example. A blood pressure reading of 110/90 means your pulse pressure is just 20. That could be a red flag. This is one of those subtle signs most patients don't notice themselves, but cold extremities? That's something you can feel, and your heart may be behind it. Now, let me say this clearly. Your body is always speaking to you. The swollen ankles, the extra pillow, the exhaustion you can't shake, they are not just the annoyances of aging. They are a language your heart is using to ask for help. And you don't need to be afraid of that. This list of 13 signs, it's not meant to scare you. It's here to empower you. Because when you recognize the early signs of heart failure, you can take action. You can get diagnosed before it becomes a crisis. You can start treatment earlier. And you can live, truly live, even with a chronic condition. Early detection opens doors to medication, to support, to time, and most importantly,
to independence. You are the most important guardian of your own health. You know your body better than anyone. So I ask you, gently, start listening, start noticing, and trust yourself when something doesn't feel right. If this video has helped you, even a little, please give it a like. Subscribe to Senior Health Tips 365 so you don't miss future insights that could save a life. And if someone you love needs to hear this, please share it with them. That is how we protect each other. That is how we stay strong together. Thank you for spending this time with me. Be gentle with yourself. Be curious. And most of all, be well. This is your brain doctor, wishing you many more years of strong heartbeats, clear thoughts, and vibrant health. You now have the knowledge. You now have the power. You've got this.